Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Okay, the differences between the following drugs. What is the difference between the verapamil? So we have to see the difference between the verapamil. Verapamil is actually a phenylalkylamine type of calcium channel blockers. Diltiazem. Diltiazem is a benzothiazine type of calcium channel blockers and dihydropyridines. So first, on the blood vessels. On the blood vessels, this verapamil will cause uh, dilatation on the blood vessels. Verapamil, diltiazem, actually all of these on the blood vessels, all of these will cause vasodilatation only. Then action on the heart. On the heart, you will have to see about the blood pressure. Blood pressure, all of these will decrease the blood pressure. The common action of all of these is decreased blood pressure. Whereas direct action, directly verapamil will decrease the blood pressure more. Okay, whereas diltiazem will decrease the blood pressure, whereas dihydropyridine has no effect, no direct effect, whereas indirect effect, indirectly, sorry, direct effect on heart rate. This is direct effect on heart rate. Direct effect on heart rate decreases maximum in verapamil and it decreases less in diltiazem, and it does not decrease or no effect on heart rate in dihydropyridine. Whereas indirect action or reflex tachycardia. So in all these conditions, both in verapamil, diltiazem, dihydropyridine, there is reflex tachycardia is seen in all these conditions. So these are the main differences between the blood pressure and the heart rate. Now, the important thing is because the dihydropyridine does not cause the decrease in heart rate. So this is important. Because the dihydropyridine does not cause the decrease in heart rate, so this dihydropyridines can be used, are the drugs which are used in hypertension. They are used in hypertension. Why? Because they do not act on heart rate, or they do not decrease the heart rate. Actually, they do not at least decrease the heart rate. They will increase the heart rate reflexly, but still they do not decrease the heart rate, and they have less cardiac side effects. So because of this, they are used in hypertension, and obviously their maximum action is in the peripheral blood vessel, thus causing decreased blood pressure.
thank you and thank you for watching.